Hello, everyone, and welcome to another exciting opportunity for young people, student leaders, to talk about current events that are taking place in the community, both locally, nationally, and of course, also our global community. Today, we are most pleased to have one of our student leaders, Victoria, to come and share with us a really important topic that's ringing around the country. And so, Victoria, without that being said, I know that you have a part A and a part B of this discussion. So I'm going to go ahead and turn the floor over to you so you can go ahead and take it away.
Great, thank you so much. Hi, everyone. I'm Victoria. I'm a sophomore, and this is my presentation on a current event that's happening right now. I hope you guys enjoy. So, this yesterday, we have entered a very large political shift, and something that they've been talking for a long time is about the prospect of a Medicare for all system in the US. And there are some people who agree, some people who disagree, some critics, some good things, some bad things. And this is my part one. I did a lot of research on this. I'm very excited. And I found all the good things and all the critiques of this single payer system. And this is my part A um, that talks about all the good things. And please, I would love for we us to discuss, for us to talk about what's happening right now. Okay, so without further ado, okay, so what is a Medicare for All? A Medicare for All is a single payer national health insurance program. What does that mean? It means that the government is willing to pay for all the health expenses of its population. With that being said, there's no networks, no premiums, no deductibles, no copays, and no surprise bills. So premiums and deductibles have to do with the money that you pay towards your healthcare insurance, for them to continue giving you insurance. And then copays have to do with what you pay upfront at a doctor's office and things for your prescription drugs, and no surprise bills. So, Medicare for All, what does that include? It includes a large variety of things, including dental, hearing, vision, mental health, which is really important for a healthcare provider to provide, substance abuse treatment, reproductive and maternity care, etc. Along with all of these benefits, Medicare for All also brings lower drug prices, which is important, and we'll talk about that in a second. So, some global examples. We have Denmark, Finland, France, Germany, Greece. What you will notice about these global examples is that a lot of them have like proportionally smaller populations than the US, and that has been a critique that has been brought up. How will the US be able to handle the influx of people coming into the single payer system? And we'll get to that. So, what's happening now? What is the status quo? So, there are 31 million uninsured people in the US right now. That's up from last year, which was 29 million, and up from the year before, which is 27.5 million. Every year, there are more and more people that are uninsured. And that is why, and that is because insurance is just expensive. 45% of uninsured adults stay that way because of the cost. That is extremely problematic, as the odds of dying among the insured relative to the uninsured is 71 to 97%. So, the insurance that someone has is very crucial for the well-being of their life, and any surprise illnesses that can come up. So that's why this source concludes that 44,789 Americans of working age die each year because they lack health insurance. So that's what's happening right now. Now let's get into how Medicare for All will solve that. First is through deductibles and premiums. So as I've said before, deductibles and premiums is something that is going to be of the past if Medicare for All is implemented in the US. Right now, 1 out of 5 working Americans report having problems paying their medical bills despite having health insurance. So let's think of it like this. Um, People of both are facing problems, the ones who are insured and the ones who are uninsured. Among those facing problems with medical bills, almost identical shares of uninsured 44%, insured 44%, and uninsured 45% say that their bills have a major impact on the family. And it's not on this slide, but a source says that around $8,000 is what a family has to pay each year because of deductibles and premiums. So implementing Medicare for all would prohibit these deductibles and premiums, which would help those who don't have insurance and can't pay for their bills, and the ones who do have insurance and also can't pay for their bills. So why does this matter? What's the impact of this? It's poverty. I found this very interesting that Medicare for all, this one social program, would lift millions out of poverty. Right now, Brewing 19 finds that 8 million of the nation's poor people would not be poor if they didn't have to pay their medical out-of-pocket expenses like deductibles, premiums, copays, etc. That leads Brewing to conclude that Medicare for All would cut almost 9 million people out of poverty directly. Okay, so moving on is the drug prices. What's going to happen with those? So right now, prices on prescription drugs have been growing at an average annual rate of about 6%. That's why 58 million adults experience medication insecurity. It is just too expensive. And that's why 34 million people say a friend or family has recently passed away because they aren't able to afford the medication and treatment that they need for their conditions. However, if and when Medicare for All is implemented, that would lead to lower drug prices for all Americans because it would allow the government to negotiate lower drug prices with corporations. Now, what is the impact of that? Accessibility and lives. So right now, 18% of Americans skip filling their prescription drugs because they can't afford to. That quantifies that the high cost of prescription drugs is what drives 67 patients into medical non-adherence. Non-adherence means is that they don't go to fill their prescription drugs, they don't take their drugs. That's why the New York Times estimates that a lack of adherence causes 125,000 deaths a year. However, the Hebrew University calculates that by lowering the drug price of 20% would increase the accessibility by 23%. And that's very important, and I'll tell you why right here. So what happens in the medical world? We've talked about how Medicare for All affects the poverty, Medicare for All affects lives, but what does it do for the pharmaceutical industry? So right now, innovation is decreasing. And it's not because the pharmaceutical doesn't have the money to innovate, because they do. But it's because the pharmaceutical companies have no incentive to innovate. This is because they are creating I'm sorry, did I cut out?
Yeah, I can hear.
So where did I leave off?
You can just go ahead and restart. You were closer towards the end of your presentation, but just go ahead and add back your slide.
Oh, all of them?
Just towards the end, I think you were right at the end.
Just towards the end. Okay.
You're doing a great job.
Thank you.
Keep going.
Okay, so
Right there.
right here, great. So we've talked about what this would happen for the poverty line, what it would have, what would how this would affect society, but how would it affect the pharmaceutical industry, the medical world? So right now, innovation is slowing down. And it's not because pharmaceutical companies don't have the money to innovate, it's because they simply don't have the incentive to. And that's really problematic because right now there's increased genetic competition of Me Too drugs that are being created. These pharmaceutical companies are looking for cheaper, old alternatives that'll bring in revenue rather than focusing on innovative drugs to actually help the people as well as bring in revenue. So, um, Medicare for All would change that. And remember when I said that the drug prices would go down 20% and the market size would go up 23%. So that's really important because a 1% increase in the market size of a drug equals a 4% increase in innovative drugs. This is because pharmaceutical companies have the incentive to innovate because of increased revenue that's coming in from the people being able to access more drugs. Then we have a value-based pricing system. When we implement Medicare for all, if and when we implement Medicare for all, the government would be able to negotiate drug prices with pharmaceutical companies. They would do this on a value system. They would see how effective the drug is. They would see if the price matches the value of the drug. They would see how well the drug does in market. A lot of factors go into value-based pricing. So, pharmaceutical companies want the best price that they can get on their drug. So, by making the drug more valuable, they're increasing their chances of having it bring in more revenue. So now they have the incentive to innovate. And then this would cause a healthy competition between pharmaceutical companies to innovate the most effective drugs towards the people. Oh, one more thing. This would also stimulate job growth. And what's really interesting about Medicare for All is because it affects everyone, the uninsured, the insured, the underinsured, there are a lot of sectors that are also affected. A lot of these sectors, Bivens 20 states that Medicare for All would create a demand for 2.3 million full-time jobs. This is because right now we have a lot of people who aren't insured and a lot of companies that take care of the people who are insured. However, in a single payer system, now the government is bringing on all that burden. So in order to handle that influx of new patients, they need more staff. And that's when 2.3 million full-time jobs are created in order to handle the influx of new patients. And right now, in countries that don't have a single payer system, there is something called a job lock. And a job lock is when a person who doesn't really want to stay in that job stays in a job simply because they're insured and fear the repercussions of leaving a job and not having medical insurance. So that they stay in that job, and we have seen patterns that companies become less effective, the mental health of the workers goes down, and it's overall harmful for the economy, job lock. But Medicare for All solves for that. It finds that countries with the universal healthcare see much higher startup rates and self-employment since people don't have to worry about the health coverage because they get it from the government. This results in a lot of jobs being created, a lot of variety in industries, and overall improvement for the economy. So just to wrap things up, Medicare for All, we have talked about how deductibles and premiums play into lifting over 9 million people out of poverty. We have talked about how drug prices are lowered, which helps with the accessibility and helps people, helps the fatality rates that non-adherence brings every year. And then we also talked about how innovation would also go up in a Medicare for All world because companies have that incentive to innovate. And we ended off saying that Medicare for All helps the innovation and helps the job growth in America. Thank you guys so much for listening to my presentation. Remember, this is only part one. These were all the good things about Medicare for All, and I have a lot of information saying about the not so good things. So if anyone has any questions or wants to ask, kind of converse, the discussion floor is open.
That was really great. Thank you for the info.
Of course. Should I stop screen sharing? Or
Yes, you can. Awesome. So now we're going to open up the floor for Victoria to share with us just a couple of questions. So why did you decide to choose this particular topic as one of the members of the current events team?
okay, so right now in what we're going through with Corona and everything, I have experienced a lot of close family members and friends lose their jobs and then lose their health insurance, which is typically not the best thing to lose during a global pandemic. So it affected a lot of people close to me. And I was looking into what this new administration would bring, what they were considering, what other politicians were bringing to the table. And I thought that Medicare for All was a pretty cool option. I wanted to research more. And then I was like, this would be a really cool thing to like present to everyone because this has to do a lot with what people are going through right now. So I thought it could be a good information for everyone.
That's awesome. Thank you so much for sharing your personal reason why you decided to jump on this. Anyone have any questions from the chat, from the audience? We'll open up the floor for about 2 questions.
I don't really have a question, but I just wanted to say that I think you did a really great job and I really enjoyed your presentation. You did amazing. I can definitely this presentation really opened my eyes because it made me realize that, not everybody is insured and not everybody is able to just go to the doctor and, get help because of not having health insurance. So I really did enjoy this presentation. It was very eye-opening. So good job.
Thank you. Thank you. Anyone else have a question?
I have a quick question. So first of all, I want to say that you did a really good job.
Thank you. You're muted? If...
Okay, so we'll come back to Faith as she's working on getting her screen back up. Let's see here.
Can you hear me now?
Now you're back. Go ahead.
Oh, I just wanted to say that I thought you did a really good job. And it was very informational because I didn't really know about all the stuff that you presented. So thank you so much for that. And the second thing is that when will the second part, when will you be presenting the second part?
So we are planning on presenting the second part next Thursday, so the 28th.
Okay, thank you so much.
Thank you.
And good job.
Thank you.
Awesome. Do we have anyone else that would like to ask a question or any other comments that you'd like to share?
Yes.
Sure, go ahead.
So my name is Katrina and I have been in this program for a while, but I haven't been really present due to my phone and computer that wasn't working. So I'm back and I'm happy to be back again.
Okay, and do you have any question for our presenter today, Victoria?
No, I think she did a great job.
All right, awesome. All right, so I think today was great. And I think that once we do have our part 2, which will be next Thursday again, so please mark your calendars. Next Thursday, the 28th, we will have part 2 to this discussion. And we highly encourage you to make sure that you come back, bring some friends who are interested in the healthcare field. This is a very important topic. It is definitely at the highest level of discussion along with the economy. And so many folks are saying, you know, if you don't have a good health, if you can't talk about health, you can't talk about wealth. So please continue to come back. And we look forward to our part 2 with Victoria. Great job. Continue doing great work, and look forward to seeing you all again soon.
Thank you.
Thank you.
Have a great day.
Thank you so much, Victoria. You did very well.
Thank you,
Thank
Rebecca.
you. Bye.
Bye, everyone.